Hi everyone, I am Dr. Miriam Smith, DNP. Welcome to the Empowering New Nurses show. I'm excited you're here today because we'll continue a new episode. Now, the last time we met, we talked about therapeutic communication in nursing, and that was actually effective. That would enhance the patient's care, the patient's experiences. Today, we'll be talking about non-therapeutic communication in nursing. What is that? Actually, it's the opposite of therapeutic, but we will be identifying 3 of them today, these techniques. What are they? The first one is attacking our patients. The patient doesn't need that. The patient is in the hospital to be helped, not to be attacked. So that's a non-therapeutic communication. That will not help the patient's recovery. Secondly, we'll be talking about interrogating the patient. Why should you want to interrogate the patient? The patient is there to be cared for, to be helped, and not to be harmed. And so when you start asking the question why, that makes the patient so uncomfortable. And that patient will lock in information that would have otherwise helped the patient. Giving you that information will help the patient to be healed, and you will have a good plan of care. If the patient chooses not to, then that will negatively affect the care. So, and thirdly, I want you to think of minimizing the care. In this case, you're actually doing what? In cases where you're stereotyping the patient, because the patient is from a certain ethnic group or the patient is from a certain background, you started having biases towards that patient. That should not happen, okay? Then you also think of not showing the patient any interest while caring for the patient. The patient might be talking to you and you are doing other stuff. You're doing other things and not showing attention or any respect to the patient. Therefore, it is important. Don't give any false reassurance also. That comes under minimizing. So it's very, very important for us to care for our patient. The patient, as I said before, the patient is there to be helped, not to be harmed. And these techniques certainly will affect negatively the care of the patient. So that's a no-no. That needs to be avoided. So as nurses, new nurses, older ones, it's important for us not to be engaged in these techniques as we care for our patients. It's a review for some nurses, but it's new for some. And so our new nurses, I want you to get into the habit of using therapeutic communication rather than non-therapeutic for our patients. Why? Our patient deserves and needs the best care, best practice. That's what we need to deliver, that type of care, high quality to all our patients. Never be engaged in non-therapeutic communication. I am Dr. Miriam Smith. I am the host for Empowering New Nurses. I know you'll be advocating both for your patients and for yourself as we go along. How can you follow me? You can follow me on Facebook, on Instagram, on YouTube, and of course, and Podcast Mirror. I look forward to seeing you. You can also comment, you can subscribe, you can put in a topic that you would like us to discuss. And of course, at some time, we'll be having our interviews of our old nurse and our young nurses. Thank you for listening, taking time out, and I look forward for you to follow. Okay? Thank you. Have a good one.